Screening for peripheral artery disease is easy with an automatic blood pressure cuff. The ratio of blood flow in a patient's legs as compared to their arms is termed ankle brachial index. This important screen can be done efficiently as part of a physical therapy assessment, or used as a screening opportunity at community events such as health or wellness fairs. To complete an ankle brachial index with an automatic blood pressure cuff, have your patient normalize their blood pressure by laying supine for at least 5 minutes. Start with blood pressure in the left arm. You can record both systolic and diastolic measurements. However, only systolic will be used in the calculation. Next, move to the patient's left leg. Align the cuff sensor over the patient's medial ankle, approximately 2 centimeters above the medial malleolus. Complete the blood pressure assessment and be sure to write down the systolic pressure attained for the leg. Repeat this process for the patient's right leg. Finish by taking blood pressure in the patient's right arm. If systolic pressure is more than 10 millimeters of mercury lower on the right arm than the left, consider repeating the blood pressure measurement on the left arm. After all measurements are taken, determine the ankle brachial index for the left leg by dividing the systolic measurement of the left ankle divided by the higher of the 2 systolic measurements of the arm. For the right leg, divide the systolic measurement of the right ankle by the higher of the 2 systolic measurements of the arm. As greater pressure is expected in the legs as compared to the arms, normal values for ankle brachial index are typically considered falling within 1.0 to 1.4. Patients with ratios less than 0.9 or greater than 1.4 should be referred to their physician for formal testing. Screening for peripheral artery disease using automatic blood pressure cuffs is not a substitute for formal medical evaluation, but rather a screening tool to alert patients of potential concerns which otherwise might go undetected. Physical therapists can play a vital role in screening for peripheral artery disease.